Stewart of Seven Investment Management. Now, as part of our NHS focus this morning, we're taking a look at the private sector's involvement in the health service. David Hare is Chief Executive of the NHS Partners Network, which represents private involvement in the NHS. David, a lot of people are quite confused when they go to the doctor. Are they seeing the NHS or are they seeing a private contractor? What can private companies do in the NHS? Where are the lines drawn?
Good morning, Dominic. I mean, I think the thing to say on this issue is the NHS, ever since 1948, has effectively been a public-private partnership. GPs have always been independent contractors to the NHS, similarly NHS dentists and community pharmacy. So it's nothing new, the involvement of the private sector within the NHS, and generally speaking, the public say they're quite relaxed about who provides their NHS
but it has,
care, as long as it's free.
It has sped up. The private sector involvement has grown quite a lot in the last 10 years, hasn't it?
It certainly has over the last 10 to 12 years. It's been a fairly steady evolution. The figures around general practice and so on are around 11.5%. Private hospitals, mental health providers, diagnostic imaging providers and so on, probably around another 7.5%. But that's really only been about 3.5% over the last 7 or 8 years. So it's been fairly steady evolution, but certainly a growth.
So about a bit under 20% of the money that is spent on the NHS goes into private providers of some form. Yeah. So what can they do and what can't they do?
So the independent sector delivers a really wide range of NHS-funded services free at the point of use. So, for example, if you go to your GP and you need a hip operation, you can choose whether to be treated in an NHS hospital, a public hospital, or a private hospital for the same price. That's one area where the private sector is doing ever more work. If you want to go for an MRI scan or need an MRI scan, around 10% of those are now delivered by independent sector organisations. So again, another area where the independent sector delivers free at the point of use.
There was meant to be a bit of a sea change in 2012 with the Health and Social Care Act, which was seen as mandatory competitive tendering. It hasn't quite worked out like that, has it? That's not quite what the Act says.
No, it absolutely doesn't, and this has been a steady evolution. The Act itself simply required commissioners on behalf of patients to ensure that they were getting the best available services. Now, that might involve tendering. The latest evidence I saw from about 18 months ago suggests only about 5.5% of contracts in the NHS were actually let by competitive tender. The vast majority, nearly 95%, were rolled over with incumbent providers. So the evidence doesn't really stack up that there's been forced tendering, but there will be times when tendering is necessary to improve a service or to change a provider to ensure that's better value.
Is there any evidence that the private sector does any better in terms of patient outcomes or value for money than the traditional NHS?
I think there's fantastic service across the NHS, whether that be public or private. A couple of stats I would sort of pull out: 8 out of the top 10 NHS-funded organisations, hospitals for hip and knee replacements, are private sector organisations. And in terms of Care Quality Commission statistics, more independent sector organisations are good or outstanding than across the NHS average. What I would say, however, is the NHS does need to get much better at the data it collects to be able to demonstrate outcomes, performance and efficiency, and there's a journey that needs to be gone on to achieve that.
Just very quickly, David, what people will fear, you've described small increases in privatisation. What people fear, of course, is creeping privatisation, which is exactly what you seem to be describing.
I think what people are really nervous about with this debate is that their NHS service is somehow going to be sold off, or that when they receive treatment, they're going to have to get their credit card out and pay for it. Actually, public is generally pretty relaxed about free at the point of use care provided by anybody.
Thank you very much. David Hare of the NHS Partners Network.